Hi, in my today's video, I am going to talk about sexual issues in cancer patients. Sexual issues in cancer patients are broadly divided into emotional issues, physical issues, and pregnancy related issues. So, I will just give a brief information about these issues. Starting from emotional issues. So, if any patient of cancer, when diagnosed with cancer, then the patient might have a depression, anxiety, or disturbance regarding adjustment disorder. So, patient cannot cope up with the new diagnosis of the cancer, and in that case, patient might have some sexual dysfunction associated with these psychological changes. So patient might not perform, or patient might not have will to do a sexual activity or decreased libido. So these are the symptoms which might be associated with the diagnosis or depression. The second thing is that many times when the patient is diagnosed with cancer, then patient's partner might feel that the cancer will get transmitted through sexual activity. So I want to make it clear that cancer cannot be transmitted through sexual activity. So doing sexual activity during cancer treatment is safe, and it can be done, and cancer cannot spread by sexual activity. Then third thing is a kind of hygiene issue. So many times if a patient is undergoing cancer treatment, especially if patient is having cancer of mouth, throat, or in that area, and patient is undergoing some treatment like radiation therapy, so patient might have some smell of his breath, or patient might have some skin reaction. In that cases also, the patient's partner might not feel of might not have a will of sexual activity. So in that case also, patient might have a sexual problems. In other cases, like the patients who are undergoing treatment for pelvis, for example pelvic radiation therapy, in that cases also patient will have problems associated with sexual activity. So which are the conditions in which sexual activity should be avoided during cancer treatment? So number one is, if the patient is undergoing radiation therapy to the pelvic area. The pelvic area is the area of abdomen below the in the lower abdomen area, in the true pelvis. If the patient is getting radiation in that area, then a patient might have some changes in the body, just like dryness of vagina. Patient might have vaginal ulcers, or in case of males, patient might have skin reaction or scrotal reaction. In that cases, the sexual activity should not be done. If the patient is having some bone disease or bone related problem or spine related problem, then also this doing sexual activity will be difficult for the patients. Then patient is having some infection, in that cases also sexual activity should not be done. So these are the condition in which sexual activity should be prevented. The next thing is pregnancy. So if any patient, whether male or female, adult patient who is undergoing cancer treatment for cancer treatment with either radiation or chemotherapy, and if the patient is young and patient has not completed the family, and patient is planning to have a pregnancy in the future, then what things should be considered? So if patient is planned for chemotherapy or radiation therapy to the abdomen area or pelvic area, then you must consider about sperm banking or ovum banking. So in young patients, they are married or unmarried, then the sperm banking or ovum banking should be considered if they are planning for a pregnancy in the future, because we can use that sperms for during pregnancy. Also, if the patient is undergoing chemotherapy, then you should inform your medical oncologist doctor about the plan of future pregnancy, because if the future pregnancy is planned, the medical oncologist can give you some medicines, so that the ovaries will be protected, and there will be more chances of pregnancy in the future. Many times if the chemotherapy or radiation therapy is used, then patient might have infertility in the future. So that's why this care has to be taken. If any patient is undergoing radiation therapy or chemotherapy, then we advise the patient to use barrier contraceptives for nearly 6 months to 1 year, and to avoid pregnancy up to 1 year after completion of the chemotherapy or radiation therapy, because the radiation therapy or chemotherapy are the cytotoxic drugs, and these drugs can affect sperms and ova. And if the pregnancy occurs between in this time, then this defective ova or sperms can give rise to mutations, and the baby might have some diseases or malformations, birth defects. So the pregnancy should be avoided. Also, in defective baby there are more chances of abortions, so the pregnancy should be avoided for 6 months to 1 year after completion of the treatment. Many patients who undergo radiation therapy for pelvic or abdomen area, or patient who undergo chemotherapy, they might have menopause. So in menopause, normally women get menopause at the age of 45, and men get menopause slowly, and it is not complete thing in the men, but in female the menopause is a complete thing. So the females will stop menstruating, so that is the menopause for the females. And if the patient premenopausal lady, means a lady who has not achieved menopause and who is less than 45 years, might get induced menopause because of the cancer treatments like chemotherapy or radiation therapy. In that case, patient might have symptoms of menopause much before the age of menopause. So in that case, patient might have symptoms like anxiety, irritability, hot flushes from the palms and soles, and also stop of menstrual cycle. So these are the effects patient can experience. Also, patient might have some psychological effects like loss of libido, decreased sexual drive. These are the symptoms patient might experience. So these are the different sexual problems faced by cancer patients. If you have any doubt regarding any cancer treatment, then you can consult me. I will give a link for paid online consultation in the description. You can also meet me at my clinic in Pune, and you can also read my book, Stop Worrying and Start Understanding Cancer, and it is available on the Amazon. So thank you very much for watching the video. Please consider to subscribe and like the video. Thank you.